Well, this is Buntingford Medical Centre, part 3. Now, first of all, you'll have to excuse the noise that this big computer is making next to me, but it's running flat out, and I didn't stop it because I'm having a lot of trouble getting the bloody thing going again. So it's running, and it's making a lot of noise. Today is the 13th of October. So let's go back where we finished off. We start on Saturday, the 18th of September. I'd gone to bed about 1:30 in the morning. The reason, I've got to get to bed at some time. I've got a washing machine being delivered and installed between 7 AM and 7 PM the next day. So I set the alarm on the tablet, put it in the open drawer beside the bed, and I've also put house phone in it, in case Doreen calls. The phone rings and it's Doreen. It's about 4 o'clock in the bloody morning. She's crying and barely understandable and tells me to get a minicab and a walking frame and come and pick her up from Lister. I spend the next 22 minutes trying to get her to understand that it is simply not going to happen. If her pain is so much of a problem in the hospital where they have access to ketamine, then to come home and hope that Buntingford Medical Centre is going to give her anything, got to be joking. Trying to explain and getting nowhere, and in the end she finally puts the phone down on me. 11:35. I phoned Lister to see how Doreen's doing. I'm told she's alright, comfortable in bed and sleepy. I've got no idea how valid that statement is, because at the moment she can't put her feet on the floor, and he's in terrible pain, so I don't know about being comfortable and sleepy. 19:35. Doreen phones. She's flat-toned, demanding, and to the point. She wants mints, shampoo, large box of tissue, cash, and a flannel. The only thing that she don't mention this time is wanting to come home. So, a little change from morning till afternoon. I hear the usual remarks about never doing anything and couldn't care less, etc., etc. Same old thing. 5 minutes later, she phones back again and waffles on about David. 19th of September, 2 o'clock in the afternoon. Doreen's just called. She sounds a bit better than last time, although she still gets upset a couple of times. She says that she would need help when she comes home, as she cannot put her feet on the ground yet. She said she'd asked about getting help tomorrow when the doctors come round. She's had the dressing on her feet replaced, and she says her feet are covered in blood. Phew, I bet they're bloody painful, not a sight you'd like to see. Probably why she's a bit tearful and permanently upset. I'd be upset and all. It's just gone 5:30 in the afternoon and Doreen's phoned again and says that I've just given her a new bed. She said it's brilliant. Sounds upbeat. Haven't heard that tone of voice for a long while. She said that it frightened her when she saw her feet as they took the bandages off. She said it absolutely made her sick. 20th of September, 1 o'clock in the afternoon. David arrived and I gave him the money, carrier bag with all the things that Doreen had asked for. He's taken them to Lister straight away. 1:30, Doreen phoned and I told her about David and what I'd given him. 2:30, Doreen phoned and she's in a panic. David has just phoned her and told her she don't exist. He's at Lister Hospital and there's no Doreen Whitehouse. And secondly, there is no burns unit at Lister either. Doreen has just asked the nurse and she's told her she's not in Lister, she's in Broomfield Burns Hospital in Chelmsford. What probably happened is that the ambulance people did take her to Lister, but when they looked at her feet, they transferred her straight to the burn unit at Broomfield. She just don't remember it. Doreen calls back and I suggest that the quickest way is for David to make up a parcel, take it to the post office in Royston, send it to Broomfield, record the delivery next day. 27th of September. Doreen phones 2 or 3 times a day now. Some days she's upbeat, others she's down. She's trying with the help of the physiotherapy staff to get her feet on her feet and start walking, but her feet are extremely painful. She knows that for the best interest that she's got to be able to get up and walk the short distance from our living room to the bathroom, about 14 paces, before they're going to let her come home. She's now been in hospital since the 13th of September and it's now the 27th, exactly 2 weeks. I don't think she'll be coming home very soon and time's really dragging on. 1st of October. Doreen's just phoned and said she's coming home today, doesn't know what time. That will make it 18 days in hospital. 7 o'clock in the evening. Doreen's just arrived home. She walks very gingerly from the front pathway to the front door, about 10 feet. Remarkable, as it's only 3 days ago she couldn't put her feet on the floor, let alone walk. We got a long way to go before she gets back to good health. 1st of October and Doreen is at home from Broomfield, 7 o'clock in the evening, and says that she had an appointment to go back to Chelmsford on Monday the 4th. That seems like a waste of time. There's no way for her to go back after 3 days. The appointment is for her to have the dressings on her feet changed. If she can't get back to hospital, would a local nurse have the necessary skill to do it? Remember, she's just come out of a specialist burn unit. It's Saturday and I need to get in contact with our doctors as soon as possible. Yeah, bloody good luck with that. Dora's managed to get from the sitting room to the bathroom every time she'd needed. So all good news. And providing the pain's managed, then we should be good to go. I've got grave doubts as to what help and backup our doctor practice is going to be for her. Time will tell. 6th of October. Doreen was supposed to go back to Broomfield on Monday, but was unable to for 2 reasons. She couldn't walk, felt really ill, and we are not able to book an ambulance. And by we, I mean general public. You can't phone them up and say, can I have an ambulance? They tell you it ain't a bleeding taxi service. Doreen phones the doctor and tries to explain, but didn't get very far as usual. She was told repeatedly that the doctor could not speak to her as they're all far too busy. Well, nothing's changed there then, has it? I don't know whether Doreen is unable to explain the urgency to them or whether they just don't appreciate the problem. They must have had paperwork come through now from Broomfield explaining her position, her problems, the operations she's had and what needs to be done. But still, you can't talk to a doctor and you can't get them to make an appointment to get an ambulance so she go back to hospital. In the end, I decided to send an email which explained that we could not book an ambulance to pick Doreen up and put some pressure on them, explaining that if they didn't get her an ambulance and Doreen got an infection because her dressings hadn't been changed and were well overdue, it would be down on them. Later on, a district nurse phoned to say they would be coming out today. Then an hour later, they phoned back to say they're not coming out today as they don't have the correct dressings or creams, etc. A bit later, another nurse phoned to say they are coming out today after all. Geez, I don't know. Poor old Doreen is now in absolute panic as the pain she's in already severe, and she knows from past experience that the removal of the dressing, which is against her flesh, takes an hour on each foot in hospital with a specialist doing it, and she's terrified. She don't have the medication that she had when she was in Broomfield. All she's got is bloody codidromol, which do nothing. Well, the nurse came and she was a charming and really patient young lady, and she She could see the fear that Doreen was in. She was calmness herself. She patiently cut away the blood-soaked bandages, with Doreen biting her lips and continually moaning with the pain. She stopped at removing the special dressing that was in contact with Doreen's skin and said that she had never seen such a product. She took a photos of Doreen's foot and sent it to a colleague by phone to evaluate, and they decided to leave that special dressing on in contact with her skin and just re-bandage it and wait for Doreen to go back to hospital on Thursday the 7th and have them completely moved and redressed at hospital. This is the first time I've seen Doreen's feet since her operation. Let me tell you, if you've got a bit of a weak stomach, then it would make you sick. Absolutely terrible. It'd be a long time for them to heal up. Still, what a really nice young lady the nurse was. Caring, efficient and kind. The phone rang later in the day and it was Dr. Nicholson. Now remember, he was a doctor who couldn't come out when he was told to by 3 separate nurses because he was too bloody busy. Well, complete change in attitude. After the call, Doreen was in shock. And she said he's fully aware of her condition and he would do all he could do to help her and would send some medication down to the chemist straight away. Question: what's prompted this change of attitude from one who couldn't care less to being aware and responsive to Doreen? Something that hasn't happened for 22 months. We think that the ambulance has been booked for Thursday. Well, let's hope so, because she needs to get to the burns unit. It's a long way for her to travel 2 or 3 times a week. It's about a 60-odd mile round trip. Has to be by ambulance. She can't walk. If she had a car or could arrange a car, the driver wouldn't be able to help her get from my bungalow to the car, wouldn't help her be able to get in or out, and wouldn't have a wheelchair. So getting her own transport just ain't on. It would be much better for everyone if a local district nurse had all the appropriate dressings to be able to do the job here on her own. That would be great for Doreen. It would be good for the ambulance service because it wouldn't be using an ambulance. But good for the burns unit. It would free them up from looking after Doreen. The pain tablets that Doreen had from Broomfield do not ease the pain to the same extent that the pain management did when she was in hospital. And she's in constant pain, and it's really upsetting to hear and see. 7th of October. We're all ready and waiting for the ambulance to arrive. We're all full of doubts as to whether we'd get her or not because the doctors couldn't confirm conclusively it'd been booked. Well, the good news, it did turn up at 8:30 and Doreen was on her way. Just hope everything goes well, there's a lot depends on it. Doreen arrived back about 1:30. She has her feet examined and redressed. She says that there are large areas of her feet that appear to have no skin on at all. The nurse changing her dressings gave Dor some really bad news when she told her that the bones on a few of her toes were coming through the damaged flesh. Just another setback, there's something more to worry about. The nurse asked if she'd ever been told that she had her feet covered in skin grafts from a donor. The thought made Dor feel a little bit sick. Doreen then said that she'd had honey applied to her feet. Now, I've seen this before. For anyone who watches TV and has ever seen the super vet, Noel Fitzpatrick, he uses honey on operations that he does on animals. So there you go, honey. Not ordinary honey you're going to buy in a shop. This is Manuka honey that I suppose is specially treated to stop you getting infections from it. The hospital have not issued her with any painkiller medications at all, other than the one she brought home with her when she was discharged from the hospital itself. These were nortriptyline, 10 milligram, one a day. All tablets in future have to come from our doctor. Now, one 10 milligram pain tablet a day is hardly likely to control the pain looking at her feet. Well, the doctor did send some medication down to the chemist on the 5th of October, and it's for mirtazapine, 15 milligram, one tablet a day. Now, mirtazapine, it's not a pain-killing tablet at all. It's a bloody antidepressant. You know, it's strange to think that for someone who's just undergone such an operation as Doreen and has 22 months of extreme pain could possibly be depressed. Remember, it's always been the pain that has caused the depression. And if the pain had at least been partially managed from the start, then maybe, well, just maybe, she wouldn't be so bloody depressed. Again, we're treating the symptoms, i.e. depression, and not the cause, which after yet more tests at Broomfield Burns Hospital is still undiagnosed. Doreen's got to go back to Broomfield today. It's the 13th. Ooh, that's an unlucky number. It's going to be a long, hard battle for her to ever go over this. What with the bones coming through her toes, whatever happens next, you just hold your breath and hope. Doreen was told to be ready by 11 o'clock in the morning. The ambulance turns up, gone 12 o'clock. She's been sitting in the kitchen, all ready to go, coat on, shivering because she's feeling the cold. It's always the same. The waiting seems to go on forever. She doesn't want to go, really doesn't want to go. She tried to make an excuse that she thinks she's got bloody flu, but I told her she's got to go. So off she went with the driver. Well, we'll leave the end of this, part 3. We'll leave it for now and we'll start again a bit later on part 4 after she comes home from hospital today on the 13th of October.